When you go home, you will use the CADD infusion pump. If you are not receiving chemotherapy, you need to change your IV bags as instructed. In this video, we will review the steps for changing the bag. For non-chemotherapy infusions, change the bag if the current bag is empty and you were shown how to start a new bag. When the infusion bag is empty, you will hear beeps and the pump screen will show Reservoir Volume 0, Pump Stopped. Press Silence to silence the alarm and press Acknowledge to clear the alarm message. Leave the batteries in. Put on a pair of clean gloves and disconnect the IV tubing from the IV catheter. Releasing the cassette is easy. Push down on the cassette latch until cassette detaches. Remove the cassette which holds the tubing that is attached to the empty bag. Discard the empty IV bag, tubing, cassette, and gloves in the trash. Wash your hands thoroughly. Gather all supplies on a clean surface. We suggest using a small, clean towel on a tabletop. You will be provided with the following supplies. The CADD infusion tubing package. You will use either high flow or regular tubing. Your nurse will tell you which is right for you. The one used in this video is a regular volume infusion set. An IV bag with fluid, medicine, or both. Please note, if the IV bag has been refrigerated, it must be taken out of the refrigerator at least 1 hour before use, so it can be at room temperature. You will also be provided with device cleaning swabs such as chlorhexidine or alcohol swabs, the CADD pump, and clean gloves. Now you are ready to connect a new tubing set into the new infusion bag. Open the tubing package and spread out the new tubing. Note, the tubing may need to be untangled. Notice the cassette and filter are part of the tubing unit. The spiked end of the tubing connects to the plugged opening of the bag. Remove the plug from the IV bag. Do not let go. Protect the open end. Remove the cover from the white plastic spike at the end of the tubing. Do not allow anything to touch the spike since this is sterile. Push and twist the spike until it is secured in the opening of the IV bag where the plug was removed. With the pump powered on, open the cassette latch. Remove the blue clip from the cassette. You will see 2 plastic prongs. These fit into the bottom of the CADD pump under the metal rods. After fitting the prongs in, place the cassette against the bottom of the pump. Turn the pump over and press down firmly. Lift the cassette latch handle into the closed position. If you experience resistance when lifting the cassette latch handle, do not force the latch. Remove the cassette and reattach. Turn the pump over and press down firmly. Lift the cassette latch handle into the closed position. When a cassette is attached to the pump display will show you how many milliliters were previously set by the nurse. It will prompt you to reset this volume. Press Yes. The screen will then show Prime the tubing. Press Yes. Allow fluid to fill the tubing and filter. Watch the ribbed side of the filter, making sure it fills evenly. Tap the filter and tubing as needed to remove any air. The priming process can take a few minutes, so be patient. Allow the fluid to flow until it reaches the end of the tubing. Some drops may come out of the end. This is okay. Press Stop Priming when the fluid reaches the end of the tubing. Press No when the pump displays Continue Priming. Press Yes when asked to reset reservoir volume. Now you are ready to connect the IV tubing to your IV catheter and start the infusion. Clean the catheter cap as you were shown. Remove the protective cap from the end of the IV tubing. Attach the tubing by screwing it securely onto the catheter cap. If the pump screen is blank, awaken it by pressing Select. The screen will show Start the pump, press Yes. Running will appear on the main screen. The green light will blink, and fluid delivery will begin as programmed. To protect the IV bag and pump, place both items in the provided pouch or bag pack. This allows you to move around freely. Check your pump 3 times a day for the green blinking light. Also, check the IV bag to make sure the fluid is decreasing. Continue to monitor until the infusion is complete. Use the patient education handouts the nurse gave you as a guide. You can also review the CADD Pump videos on my chart if needed.